everyone, my name is Anna Shu, and today I'll be presenting my empirical case study titled Ethical Communication and Patient Confidentiality in Electronic Health Records, or EHR. This case study was conducted as part of the Business Communication for Healthcare Managers coursework in the Paul and Virginia Engler College of Business at West Texas A&M University. This case examines how communication breakdowns and leadership failures at the UCLA health system led to serious violations of patient privacy when employees accessed celebrity patients' medical records without consent. This topic connects closely to our course focus on healthcare communication and management, particularly how ethical leadership and transparent communication intersect with modern technology and clinical systems. Let's begin with an overview of the case background and its main findings. In 2011, the UCLA health system paid $865,500 to the U.S. Department of Health and Human Services after several employees accessed celebrity patients' medical records without authorization. The Office for Civil Rights found that UCLA failed to implement key safeguards such as real-time audit notifications, role-based access controls, and ongoing staff training. The study concludes that poor communication from leadership, inconsistent enforcement of ethical standards, and limited moral education allowed a culture of complacency to develop. Core ethical principles such as autonomy, beneficence, and non-maleficence were compromised as patients lost control over their personal health information, weakening trust between providers and patients. The study also emphasizes that technology alone cannot guarantee ethical outcomes. Effective governance, ethical leadership, and clear communication are essential to support a culture of compliance and trust. Now that we've reviewed the background, let's move into a critique of the study and its broader implications for leadership communication. This case does an excellent job linking ethical theory to leadership communication, but one limitation is that it doesn't fully address how modern technologies such as AI-based monitoring systems and blockchain audit trails could prevent similar breaches today. From a communication standpoint, I found Argenti's insights especially relevant. Effective internal communication requires clarity, consistency, and reinforcement from leadership. UCLA's failure to reinforce its privacy expectations shows that written policies alone are not enough. They must be communicated, modeled, and repeated at every level of the organization. This also ties to Sheen's concept that organizational culture reflects leadership behavior. Without consistent accountability and transparent messaging, even advanced information systems can fail ethically because employees take their cues from the tone leadership sets. With that in mind, I'd like to pose a few open-ended questions for discussion. 1. How can healthcare leaders move beyond compliance-based communications to cultivate an organizational culture where ethical behavior and confidentiality are internalized values rather than enforced rules? 2. In what ways might advancements like AI monitoring or blockchain technology improve patient confidentiality, and what new ethical challenges could they introduce? 3. When employees breach patient confidentiality, what role should restorative justice play compared to punitive discipline in repairing trust and reshaping communication norms? And finally, 4. How can healthcare managers effectively communicate privacy policies so that they are not only understood by staff, but also emotionally reinforced and lived out in daily interactions with patients? Let's finish with a few key takeaways. In conclusion, this case illustrates that ethical communication, leadership accountability, and technology governance must work hand in hand to protect patient trust. The UCLA case reminds us that innovation without ethics can lead to reputational and legal harm. As future healthcare leaders, our responsibility is to cultivate a culture of ethical transparency, where privacy, accountability, and open communication are shared values that guide both behavior and decision making. Thank you for listening, and I look forward to hearing your thoughts on these discussion questions.